Joining us today and for covering today's briefing. Today I'm joined by Dr. Michael Mendoza, Monroe County Public Health Commissioner, Mary Beer, the Ontario County Public Health Director, Dr. Nancy Bennett from the Finger Lakes Vaccine Task Force and the Finger Lakes Vaccine Hub, and Wade Norwood, the co-host of the Finger Lakes Vaccine Task Force, and of course from Common Ground Health. We're here today. There's obviously a lot of questions over the last several days related to vaccine distribution eligibility in the region, and so I wanted to take an opportunity here to bring some people together to be able to help answer your questions and also provide an update on the work of the Finger Lakes Vaccine Task Force. As we've been saying from the beginning of the vaccine arriving here, and we're saying it repetitively but intentionally, and it needs repetition. Supply still remains low, but demand remains very high. That's not to say we're not getting vaccines in arms, even though the supply is low, because we are. Just last week, Dr. Nancy Bennett announced that the Finger Lakes region administered the 100,000th dose of vaccine. So 100,000th dose of vaccine just last week here. And here in Monroe County, our pods at the Riverside Convention Center, the Fleet Center, have administered over 14,000 first doses and 3,700 second doses of vaccine. The state-operated Dome Arena site recently announced its 10,000th dose. And just last weekend, New York State hosted another equity pod here in Monroe County, this one at the Rochester Riverside Convention Center, where over 540 people received their first dose of vaccine. And that effort was really remarkable to see the community coming together for this effort. Volunteers of the faith community, the United Way of Greater Rochester, the Monroe County Department of Public Health, all employees working together to help our community heal and bring hope to those who need it. Now, we understand the frustration many who have not been vaccinated are feeling. For those who are eligible, we're asking you to continue to remain patient. More vaccine is coming, and we have the manpower, and capacity and logistical setups to get the vaccine out as quickly as possible. It is going into arms as soon as we receive it. But as we talked about before, the amount of vaccine in the supply does not equal the demand. And our goal all along from the beginning here in the county and in the region is to make sure that our capacity to administer the vaccine meets the supply that comes into the region and frankly exceeds the supply, so that we're always ready on a week-to-week basis, not knowing how much vaccine each vaccinator will get until you're about a week, until each week. We need to make sure that our capacity to administer it stays ahead of that. So just last week, New York State announced that starting this coming Monday on February 15th, that it's expanding vaccine eligibility to those with identified comorbidities that include cancer, chronic kidney disease, pulmonary disease, intellectual and developmental disabilities, heart conditions, severe obesity, pregnancy, sickle cell disease, and some others. The complete list can be found on the New York State Department of Health website. We're continuing to get more information about how we're able to incorporate the new eligible individuals into our vaccination efforts at the county and throughout the region, including whether we'll be receiving additional allocation for this expanded group. But what we do know is that the responsibility for managing that distribution will be through the local health department. We have made a decision in the Finger Lakes, which Dr. Mendoza and Director Beer, I'm going to have them talk about this more. But I do want to underscore that right now, those with the comorbidities who are seeking a vaccine do not need to call your doctor's office right now and have a note. So I'll repeat that. You do not need to call your primary care physician or doctor's office to receive a note from them acknowledging your medical condition. They have been flooded with phone calls, I know, over the last several days and months. Again, I'll let them speak to that. But instead, we'll be working a system here locally that was created as an option from New York State to identify your medical condition and your eligibility through a signed attestation to confirm that is then audited and verified later by New York State. So again, we're unsure still of the allocation of vaccine that we'll be receiving that is identified for individuals with the health conditions. And we also still, I don't believe, have our allocation for next week in general either. So the appointments are not made available yet. You do not need to call your doctor, but certainly as soon as we have those numbers, we have those figures, we will give that to, we will be able to get to people, get people scheduled, and be able to expand the eligibility. So we expect to have those details in the coming days, and obviously we'll let you know. So I want to thank the community for your understanding, for your patience during these trying times, and really throughout this unprecedented year. I do not want anyone to lose sight of all that's been accomplished, particularly over the last several months, in bringing the numbers down, flattening the curve, in protecting our community and keeping people safe. And now we just have to work together, understanding the supply and the availability of the vaccine, or the supply availability and the demand for the vaccine are very different things. We just have to work together to remain patient and understand that there is a light at the end of the tunnel. It's a long tunnel. There is a light at the end of the tunnel here, and we have a lot of great people working on that with us. So with that, I'm going to turn it over to Dr. Michael Mendoza, our Monroe County Public Health Commissioner, who will talk a little bit more about that, and we'll introduce the other panelists today. Thank you.
Thank you, County Executive Bello. I simply just want to underscore that although there is a lot of demand and a lot of frustration about this vaccine and the supply of it, I do sense a bit of optimism now that the capacity is opening up. We are seeing now that the health department, who prior till today was limited in its ability to vaccinate people only to those essential employees, we now have the ability and the permission to provide vaccine to others outside of that eligible employee list. And so, as the county executive mentioned, effective on Monday, February 15th, we will be vaccinating, offering vaccine to people who have those medical concerns that were listed earlier. Now, obviously, we're not going to be able to meet all the demand of all these people. When you add it all up, we're talking about thousands and tens of thousands of people across the region who will qualify. So we are in the final stages still of trying to figure out how we will do this for the coming week. We are not able to schedule any appointments until we have the vaccine on hand. Obviously, we don't want to schedule for appointments that we can't promise. So we will learn about the quantity of vaccine that we intend to receive next week, sometime this weekend, and then we will open up the plan for scheduling those appointments as soon as possible, starting on Sunday. The plan will be to exhaust all of the vaccine in the coming week, as has been the plan up until now. And so we anticipate undertaking the same approach this coming week. I want to underscore also that for your signing up for the appointment, you will not need to provide a letter from your physician. You do not need to provide any medical evidence. You don't have to go through your medical records to try to find some way to prove that you have one of these concerns. We simply ask that you attest, and we will ask you to sign a form that indicates that you have one of the concerns listed on that page, and that will be sufficient. We want to make it as simple and as streamlined as possible, and so that will be the approach going forward, not only here in Monroe County, but across the region. We want to make this simple. We understand that we're one community. We don't want to have expectations here in Monroe County that are different from Ontario County and so forth. So we want to create a uniform approach to provide as much simplicity and efficiency to our public as possible. So with that, I will turn it over to my counterpart, Director Mary Beer from Ontario County.
Thank you, Dr. Mendoza. The rural counties in our region, that includes Genesee, Orleans, Wyoming, Livingston, Yates, Seneca, Wayne, and Ontario, are all in agreement, and we met with Dr. Mendoza as well, that we too are not going to require a doctor's order or a note from your physician. You will also have to, when you come to the clinic, you will attest to the fact that you have this, one of the conditions. And I want to just assure you that all of the rural health departments have been working hard and giving as much vaccine as we receive, along with our hospitals in the region. We also successfully did our first pop-up in the region in Geneva last weekend, and it was a joint venture between Seneca, Wayne, Ontario County Public Health Departments, as well as Finger Lakes Community Health. We were able to vaccinate 317 individuals, and it was the target individuals of the African American and Latino race, and it was a great venture and very well received by the community. So we are poised and ready, and the more vaccine we receive will be in people's arms just as quickly as possible. Thank you.
Okay, great. Thank you, Director Beer. And then now we'd like to turn it over to Dr. Nancy Bennett, Finger Lakes Vaccine Task Force and the Finger Lakes Vaccine Hub.
Thank you so much, County Executive Bello. This is all great news that we're expanding eligibility and that we will be able to vaccinate more members of our community. But I'm also here to remind us that, as County Executive Bello said, demand far outstrips our vaccine supply. So just to make you aware of where we are right now, this week we received about 13,225 doses to our region. That's a little short of what we received last week. We're hoping that we will see increases over the course of the next several weeks. We've been being told that both by the state and also by the federal authorities, but we didn't see an increase this week, which was a little bit disappointing. I thought that the other question that you might have would be, where is the vaccine going? And so we have a slide, if Elisa can put that slide up.
I'm working on it, Nana. I don't know if, oh, there it is.
Okay. I can keep talking. Oh, there it is. Can you share your screen? It's not showing up, I don't think, for everybody.
I believe the county is sharing that for us because I can't do it.
Can you all see it?
Mm-hmm.
Because
yeah,
I can't.
We can see it. Yeah. Dr. Bennett, yes, we can see it. Yep.
Okay, great. Well, so what we wanted to highlight on this slide and that we thought might be useful for people to understand is the variability in where the vaccine goes. And this is weeks 1 through 9. We're in week 9 right now. And as you can see, in the early weeks, most of the vaccine went to the hospitals, and that was for the purpose of vaccinating healthcare providers. As time went on, more vaccine went to the public health agencies so that they could vaccinate essential workers. More recently, you can see that there's a lot of variability in where the vaccine is going. The hospitals are receiving only enough to cover those who are in 1A, that is healthcare workers who have not yet been vaccinated. The public health departments are still receiving vaccine to vaccinate essential workers, and as Dr. Mendoza and Ms. Beers said, they will be expanding the groups to which they can supply vaccine. One of the groups that's gotten quite large is the pharmacy group. They're getting more and more vaccine as time goes on. This is great because they're spread out throughout our region. They don't have the capacity to run as many people through a clinic as we can do in more mass sites, but it is important in terms of distribution that they are out there. And currently they are providing the lion's share of vaccine to those who are over the age of 65. So very critical group for us as well. You can stop sharing if you like. The thing that's really important that we have to keep in mind is that we do have a lot of people to vaccinate in our community who are currently eligible, and there will be more as of Sunday and Monday. We know that by the end of this week, we will have distributed approximately 120,000 doses in our community. However, there are over 300,000 people who are eligible to be vaccinated strictly in the old categories, that is the 1A and 1B, without adding those who have chronic conditions. So we're going to have to be very mindful as we move forward to ensure that we don't leave behind groups of people who, for one reason or another, have not gotten access to vaccine. So you will see, I think, in our efforts, a real focus on those groups that we feel have not yet been vaccinated sufficiently. And we will try to move forward as expeditiously as we can. And finally, it really does all depend on vaccine supply. We have been able to look at our current capacity, and there's no question that our region could deliver many, many, many more vaccines every single day if we only had the supply. So stay tuned. We hope the supply will increase, and we are really, really hopeful that we can use our enormous capacity to vaccinate more of our citizens. Thank you. And now I'd like to turn it over to my co-chair of the Vaccine Task Force, Wade Norwood.
Nana, thank you very much. And it's on the note that you ended that I'll pick up, because what I'd like to do is just use this as an opportunity to recognize and thank the incredible community partners and volunteers that have made the work that we've been able to do as a community through these so-called pop-up temporary vaccine clinics, because they have been an incredible means by which we've been able to be very intentional about how it is that we can model approaches that will move the vaccine not only efficiently through our community, but also equitably. These pop-up events, although small, these clinics have been incredibly successful at getting our most vulnerable and our least likely to be reached community members vaccinated. And through them, we have demonstrated to the state our ability to set up these clinics, even though we've gotten very little forewarning, again, because of the incredible ability of our community partners to join us in this work, to join the task force members in this work of literally protecting the lives and the families that make up the Finger Lakes region. I just shared quite simply and briefly at Mount Olive in Geneva, over 300 folks were vaccinated. At the Riverside Convention Center, over 500 folks were vaccinated. At Seneca Towers in Rochester's Northeast, almost 300 vaccinated. And at Mount Olivet in Rochester's Southwest, over 285 people vaccinated. In those cases of the inner city of Rochester sites, incredible turnout and reach in the Black and the Latino communities. Supply remains our most pressing issue. I have every belief that we could continue to have these types of outreaches that drive equity, both urban and rural, if we can overcome the supply challenge. And I believe that towards getting ready for that, the most important thing that we can continue to do is make sure that community resources are available to these community partners. And so we have formed a speakers bureau that is developing consistent and vetted information to share out with the community in groups large and small, virtual conversations that are matching volunteer experts, medical professionals, and other speakers from affected communities with those communities are available now, and anyone interested in securing a speaker who can share facts about the vaccine and the vaccination process can reach out to us at Common Ground Health, and we will provide that matching. And we will also continue to provide resources that can be shared with our network of trusted leaders and organizations in as many languages as we need to provide, so that we can close the gap between the need and the resources available. Thank you very much, Mr. County Executive.
Thank you, my friend. And with that, we can open it up to questions for any of the panelists here.
Great. First up is Randy Corbin from WXXI.
Yeah, hi folks. Thanks for taking my question. I don't know if Dr. Mendoza, if you would be able to answer this. I know it's kind of a state thing, but I got a phone call today from a teacher, I believe from the city school district, who said there might have been some kind of a glitch at the state-run Dome Arena site where the numbers weren't matching up, and several of his fellow teachers had the same issue. And then I saw someone else online, it might have been Channel 10 today, mention some similar issues. Are you aware of anything? I don't know if the county would have any involvement in that, but have you heard of any problem today with vaccine distribution?
Yep. Thank you for your question, Randy. I was made aware of that around 9 o'clock, I think, this morning. from a number of people who had scheduled appointments there. And as you know, the Dome Arena is a state-run site. I think what happened there was that there was a link that had gone out that was somehow invalid earlier in January, and a lot of people had the impression that they had had an appointment today at the Dome Arena, but it turned out that that was not the case. So I understand a number of people needed to be sent away, which is unfortunate. But I think that was due to an early glitch in the system, the scheduling system, and I know that the staff at the Dome Arena is working very hard to get to the bottom of what happened this morning.
Yeah, thanks. Yeah, I reached out to the state, haven't heard back, but that's helpful. Thanks very much.
Mm-hmm.
Do you have a follow-up, Randy?
No, I'm all set.
Okay, thank you. Next is Penny Seeger from the Minority Reporter.
Hi, thank you. With comorbidities now being added, and we know that comorbidities in the minority community are very high, what will be done to make sure that this scarce resource, more people eligible, reaches folks who have these underlying conditions in very hard to reach areas?
Well, this is a very complicated question, as you can imagine. I think what we are looking toward doing is developing an infrastructure that will adapt with us as we get more and more vaccine. We're still obviously very early in the game, and with Monday coming actually very, very quickly, we're going to need to use existing infrastructure to get through this coming week. And we know that existing infrastructure will not be adequate. So while we work to get through the vaccine in the week to come, simultaneously, we're working to develop a broader network so that we can make sure that we get that vaccine out to all of the traditionally hard to reach corners of our community. So it'll be a multi-pronged approach. I think it's important for us to be planning ahead. It's important for us to be nimble, because as we learn, we want to be able to pivot really quickly to get the vaccine into all of our communities. But it will be a work in progress, and it'll be a very complicated process.
As a quick follow-up, I'm told that the state has the numbers for vaccine equity. It's not done locally as to where the vaccine is being distributed for different populations. How can we, the public, be sure that the equity is being met, that's being talked about, if there are no numbers to show exactly where this distribution is going?
Patty, we are very concerned with this and have been lobbying very hard to have access to those numbers. We understand, for example, in New York City that they did get access to their data regarding who's been vaccinated. Here we have not thus far. We do have a plan. We're working with our regional healthcare information organization to receive data from New York State. The RIO will actually be able to help us to ensure that the data are accurate with respect particularly to race and ethnicity. And once we have those data, they will be shared. It's been a long process, and we have been advocating loudly about this from the very beginning. But for reasons that are unknown to us, it's been slow in coming.
If I may, I would just tag on to the back of that to just note and really salute the RIO, which is a real hidden gem and a very valuable health resource for this community. At the very moment that the task force was announced and we established the goal of equity, the RIO and its team swung into action and began the effort of lobbying the state to be the recipient of that data, as they have a long history of dealing with HIPAA qualified data, but yet making sure that community information is shared from that data set. And we are very hopeful that their efforts and our joint advocacy toward that end will get that data available, because it is essential that we have transparent data to be able to measure our effectiveness.
Thank you.
Patty. Next is Andrew Freeman from Spectrum News.
Sorry, could you actually come back to me? I got another reporter that's sending me a question right now.
So we'll go to Brian Sharp from the Democratic Chronicle.
Thank you. I was just wondering, with Dr. Bennett, you had mentioned needing to make sure nobody is left behind. And I'm wondering, as we continue to add to eligibility, it seems every couple of weeks, how do we, without abandoning the randomized or first come, first serve process, how do we get back to those people who were in 1A, who are your 80 plus or others?
Thank you for that question, Brian. So right now, the hospitals have been focused on, if you will, cleanup of 1A. In other words, they have been reaching out to people across the community who, for one reason or another, didn't get vaccinated when 1A people were being vaccinated. And let me just remind you, 1A is healthcare workers. And then the other part of 1A was the residents and staff of nursing homes. What we are seeing is that in the nursing homes, for example, there are staff members who chose not to be vaccinated when they were first offered vaccine, but now would like to be vaccinated. And yet the resources are not there anymore to vaccinate them. So we are at the hub trying to sort of marry people who need to be vaccinated from 1A to vaccinators. And at this moment, that's largely the hospital systems that still have vaccine for 1A. In addition, 1A members can go to the Monroe County Department of Public Health Convention Center site for vaccination. And then we have 1B, and there are many essential workers in 1B that are getting vaccinated quite quickly through the Monroe County Department of Public Health site, but there are still many more to go. And the health department will continue to work on that population. With respect to those over the age of 65, as you know, we originally thought that the hospitals would be able to vaccinate their own patients, and they had developed lists and were calling people in, but they have not been receiving vaccine for the last several weeks and have not been able to vaccinate their patients. As a result, patients have had the opportunity to go to pharmacies, potentially to the Dome, but really that group still has a long way to go. We're hoping to develop some systems to reach out to independent living facilities and public housing where there are a lot of elderly people. They are definitely at the top of the list, and they will remain so as we go forward.
I'll just add that for 1B, for the majority of 1B, many of those essential employees belong to a group that's relatively easy to reach. So educators in schools, or bus drivers, or law enforcement personnel. We're generally able to reach those through their employer. And so we keep going back to those groups, trying to make sure that we've caught up with everybody. And so that's been our approach to date, to bring those essential employees into the convention center or whatever site we can bring them to. It will become more challenging, though, once we broaden to other employee groups for whom there isn't a natural way to connect with them. So we've been working with the Greater Rochester Chamber of Commerce to connect broadly with businesses, but as you can imagine, that's a very large group. We've been working with United Way to make sure that we've got those channels in place so that when they become eligible, food service, food link, shelters, so forth, that we have that communication path ready to go. But again, right now, the challenge is that we don't have the vaccine supply to bring to them.
Did you have a follow-up?
Yeah, I was just wondering also, I think, Dr. Mendoza, you had mentioned something along this line the other day or a couple weeks back about people sharing links, but I'm wondering if you're running into much of a problem with people basically appointment shopping, booking appointments where they can, then getting an earlier one, not canceling the other one, if that's becoming an issue at all.
It is an issue, primarily at the larger sites where the links can be open for a while and then people will just schedule whenever they can. So the convention center, it is somewhat of a problem. I think having visited the Dome Arena on a weekend, they had a number of appointments where people didn't show up. They have a process in place where they're actually calling in advance and they can look on their schedule and see the same name on the schedule 4 times. And they're calling to confirm if that's 4 different people or if it's somebody who did what you just described. And if they find out that those appointments are no longer necessary, they have a standby list, if you will, to try to bring people in, or they will make those appointments available again through the link. So that link that is available, and often when you go and try to schedule an appointment, there is nothing there. you may find that, randomly in the middle of the day that some appointments open up, and it's because of them recycling these appointments that they're finding are no longer necessary for people who did what you just described. So it has been a challenge, and we're encouraging everybody who has made multiple appointments, if you've gotten your vaccine, to please cancel any other appointments that you might have to make that spot available for other people.
Thanks, Brian. Next is Daniel Kushner from City News.
Yes. You all mentioned the supply shortage of vaccines earlier. Are there any concerns, though, about the ability of the county's vaccination sites to administer an increased number of vaccines when they become available? I guess what I mean by that is I'm wondering if there are plans to increase the number of staff at these sites to coincide accordingly.
Absolutely, absolutely. We have plans. If we could have 40 vaccinators on site, we can do thousands in a day. I mean, we're ready to go. The United Way has provided a vehicle for recruiting staff. We're, like I've said in the past, we're all dressed up with nowhere to go.
Yeah, we have a model where we've looked at capacity in the region, and the capacity is on the order of 30,000 vaccines a day. And, we're so far from that at this point that there's a lot of untapped capacity. And as Dr. Mendoza mentioned, we also have the United Way has created a volunteer group that numbers over 2,000 now, and a large number of those are actually clinicians who can deliver a vaccine. So we have lots of untapped resources.
And I'll just add that I'm just incredibly proud of the community because of this. There's thousands of people have volunteered. The county had an intentional process going back to last November to hire COVID clerks into our testing effort, knowing we're going to have to expand into a vaccine effort, and had set that goal all along that our capacity would greatly our capacity to administer would always greatly go beyond how much supply is here. But we're also hearing from a lot of great community-based organizations who are offering up their buildings and are offering up locations to serve as vaccine clinics and sites, and that is fantastic, and that's wonderful. We have a lot of people who have reached out and offer not just bodies but locations, and we are cataloging that information so that we are always ready, and so that we'll always be able to exceed the supply.
I would add that the rural counties also have the ability to ramp up greatly. We've been seeing that the hospitals have been very effective, but also the local health departments. We have so many volunteers, and it's been a wonderful thing to see across the entire region. So just want that vaccine to keep coming.
Do you follow up, Daniel?
Not at this time. Thank you.
Great. Thank you. Next is Charles Molyneux from WHB.
Yeah, this would be for Wade Norwood. We're hearing about an initiative elsewhere, not in this area, where Walgreens and Uber are actually launching a cooperative venture to provide transportation for underserved communities, rural communities, and the like, to get to vaccination sites. Is transportation an issue for some of these communities? Do you see any need for something like that in this area? How is that being addressed? How could it be?
I have not heard of that initiative. Yes, transportation remains always a problem for access to needed services. And so the fact that and that's why I started with the issue of the pop-up clinics. I think that as important as it is for us to think about ways to help people get to centralized sites, it's more important for us to give thought about how it is we might get the vaccine to where the people are. And were we blessed with more supply and a more reliable, predictable supply, given the community partnerships and the interest, I think we could do more of these clinics that are located where the people are. And that would help us with equity. That would help us with uptake. And so I'm interested, and I'll keep my eyes out and learn what they're doing, how that might be a practice that we could model. But I think the more important thing is let us solve the supply problem and let us get the distribution sites where they need to be, urban, rural, and suburban.
I would like to give a shout out to RTS as well, because they did help us bring people to our clinic, the pop-up one in Geneva, and at no charge. So it's just another example of partnerships and the relationships that have been out there for years, and how we're able to tap into those and then deliver what we need to deliver for public health.
Mary, thank you for that shout out, because it was RTS that also served wonderfully with regard to helping us move folks who were recruited by the churches in the heart of the city to the Riverside Convention Center for that highly successful vaccination clinic offered by the county. Without a doubt, we have been blessed by having a public transportation authority that understands its role in health improvement.
If I might direct something to Dr. Mendoza, we've seen the new standards coming out now from the state for large performance venues, which will be able to start having big events. There are limits on the number of people who can be there, but also standards for things like testing and preparation. Is Monroe County ready to start executing something like that? Is the infrastructure in place? What has to happen?
Well, thankfully, we have a months-long track record of doing testing. And so while we haven't yet gotten the guidance from the state on the testing prior to these larger events, I feel confident that we'll be able to plug that into our existing infrastructure. We have the test kits, we've done the education, we've got the scheduling system in place. I'm waiting for the details, but when those details come, I'm confident that we'll be able to get that done.
Thank you.
Next is Will Astor from the Rochester Beacon.
Yes, thank you. We've heard over and over that, you know, the demand far outstrips the supply, and some optimism about the supply. Do you have any actual information on when and how the supply might increase, and what line of communication do you have with the state, what line with the federal government through the state?
Yeah, we don't have much information. At a national level, we know that Pfizer and Moderna, probably those vaccines are going to continue to be delivered at about the rate they're being delivered at right now, with some slight increase. The new vaccine from Johnson & Johnson will be going to the FDA on the 26th of the month for consideration for an emergency use authorization. If that is granted, that will add considerably to the supply of vaccine, and I would anticipate we would see that probably starting in mid-March or so.
Do I have a follow-up?
Sure.
So at the rate we're going now, when would you anticipate that? I mean, how far are we from catching up?
Well, it depends what you mean by catching up, I guess.
Well, I mean, for everybody to get herd immunity, let's say.
Yeah, it's a long haul. If we had all the vaccine in the world, we could do it in 5 months, no problem.
Okay, so at the rate we're going now, it's longer than 5 months?
Oh, yes.
How much? Any?
It depends. You know, there's so many different variables in the model. I'd hate to give you a specific number, but a long time.
Okay. So
I mean, you know, it is speeding up. There's no question that we're, you know, except for this week where we didn't get a lot more vaccine, but I think we are generally getting more vaccine every week, and it is speeding up. So, you know, best case scenario, if we had all the vaccine in the world, we could do it in 5 months. Worst case scenario is it's going to take considerably longer than that.
Okay, thanks.
Last up is Andrew Freeman from Spectrum News, if you're ready.
Yes, already. Sorry about that before. This question's for Dr. Mendoza. Dr. Mendoza, I just wanted to ask you about something you said recently on social media about feeling comfortable with resuming visitations to nursing homes.
Mhm.
I was wondering if you could talk about your thoughts on that and maybe give a timeline on when families might be able to come in and see their loved ones.
Well, we've come a long way in this actually very sad story with the nursing homes. We know our nursing home communities here in Monroe County have borne a very disproportionate burden of the deaths in our community. About half of the mortality here in Monroe County among residents of nursing homes, another 25% of people living in assisted living facilities. So it's a vulnerable population, and it's also a population that we sorely miss. And the families of those who have loved ones in nursing homes sorely miss their loved ones. We know there are benefits to that connection, a connection that they've not had the opportunity to enjoy now for months. We also know that we want to keep them safe, and we certainly don't want to take any unnecessary risks with a highly vulnerable population. Where I think things have changed dramatically is that upwards of 85%, if you look at the state vaccination dashboard, 85% of the residents of these long-term care facilities in Monroe County have now received at least one of their 2 shots. So we're quite a bit down the path now toward creating that safer space. So I think now is the time to entertain a plan, and to figure out the plan for that. That's going to be something that will have to be developed at the state, because the state is ultimately who governs the nursing homes. But here in Monroe County, I'm very open to having a conversation, trying to develop a plan and see what we can do to help our loved ones.
Thank you so much.
Okay, great. Thank you all for joining us today. I think that's everyone. I do want to add one thing, just to be clear, as we talk about vaccine. Andrew, do we miss you?
Last but not least.
Sorry.
No worries. Just a quick one. I'll be quick. On that same note, with opening things up, a letter sent, this is Dr. Mendoza, a letter sent from the Fairport School District to you, to County Exec Bello, and to the state, asking about the return of high school sports. Can we use that same model to get kids back in classroom? Did you guys see that letter, and have you had time to think about that and offer some input on that?
Well, I'll start, and then I'll let the county exec finish off with the last word. But yes, I can understand the frustration. I can appreciate, as a parent, wanting my kids to go back to school as well. I can certainly understand what might feel like a very apparent disparity between sports activities and school activities. I can say that the reopening of educational curricula is very, very important. And I will offer that it's more important than sports. But the reality is that sports came first. Sports, to some degree, are a little bit more easy to reopen in many ways. But when we look at reopening the schools, it's going to be a very, very complicated task. Ultimately, that guideline will come from the state. The state is who the schools engaged in with developing their reopening plans back in the early fall. The school districts have been working very hard throughout the year, and they have been following their plans. When we meet as a group, I offer, sort of the public health context, the medical context as new science comes along, but ultimately the school districts have to work that out with the state education and the State Department of Health. But I think now is the time to consider it, now that the positivity rate is low. Obviously, we have the possibility of these new COVID variants sort of looming in the horizon, so we have to be vigilant. But I think now's the time to entertain that conversation, absolutely.
Honestly, I don't have a lot to add there. So that was a perfect response, and the schools are working very hard to meet those state guidelines, and I know we'll continue to do so. And so what I wanted to add here as we close up is that as we talk about vaccine shortage, one thing I do want to be clear, because I have a number of people reach out to us about this when we talk about the supply not meeting the demand. We're referring to the first dose supply, not the second dose supply. Okay, so whenever you hear us talking about how much new vaccine we have each week, what's the supply week to week of the vaccine, we're always talking about first week unless we say, or the first dose, unless of course we say something different. So there is no shortage of second dose. So if you had your first dose, you should be scheduled with an appointment wherever you got that first dose. You should be scheduled an appointment for the second dose, and there are no issues right now with the supply of the second dose. So we're only referring to first dose. So with that, thank you very much. I appreciate it. Thank you to all the panelists today for joining us today and answering all the media's questions. We'll see you next time.